The healthcare detective, Frank Lalli, has written a book for Simon & Schuster about how to get affordable healthcare. Called Your Best Healthcare Now, it is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade, the former editor of Money and George magazines, and a senior advisor to healthcare.com. There, I shortened it. Hi, Frank. How are you?
Yes, you covered the bases. And long-time healthcare detective for Robin Hood Radio, and I do most of my work for you right now. So, look, we've got to talk about the coronavirus again, and sadly we do. And really, we've got to give you as much information as possibly can about Omicron because it's a real threat. So I set it up so that I will ask the questions that I expect the listeners need answers to, and then, son of a gun, I will answer the questions. So, question number one. Do I really need a third booster shot to beat back the new COVID variant that's Omicron? Well, yes, you do. I mean, 2 shots of Pfizer or Moderna, what we've been calling fully vaccinated, hey, you're okay. That doesn't provide enough antibodies to stop the new one, the new Omicron. Preliminary studies say that Pfizer vaccine is anywhere from 7% to an alarming 40% less effective against the current dominant strain, Delta. So it's 40% or could be 40% less effective against Omicron. So we should expect a similar drop-off if you had Moderna. So look, in fact, and this one startled me when I learned it, 75% of America's first Omicron cases, there are only about 70 of them, but 70% have been breakthrough infections among people who were, quote-unquote, fully vaxxed. So you need the booster. So anywhere from age 16 and up, you need a third shot to stay protected from serious COVID illness. Now, there is one exception. If you've had COVID followed by 2 shots, scientists say you have as much protection as a third shot, so you could skip the booster. But make no mistake about this. If you've only had COVID months ago, you are not immune. You are a sitting duck to get it again. I ran into a guy on the rail trail doing my exercise, just waving at me and saying, I've had COVID. I don't need a mask. Well, having COVID and not getting shots doesn't leave you protected at all. So I'm sorry.
Yeah, so we are discounting completely natural immunity because, in other words, the people that I know who have had COVID and have massive antibodies, that antibody response hasn't diminished. They get tested regularly. So I'm trying to figure out how at all events.
Here's what the scientists say, Jill. You're protected for about 3 months, which is nothing. Which is half of the protection you would get from a shot. So yes, for a brief period of time after you've had COVID, you are protected, but it wanes very quickly. It's no substitute for a shot. All right, question number 2. Should I get a booster now or wait until Pfizer and Moderna roll out a vaccine targeted at Omicron, right? Seems to make sense. But scientists say get protected as soon as possible. Get that third shot. First off, if you got your second shot 6 months ago, you're eligible for the third shot to fight Delta, and that's just when your antibodies are waning. It'll fight Delta, and it also fight Omicron. Plus, if you wait, odds are that Omicron will become the dominant strain months before we get an approved targeted Omicron vaccine. So you'll be sitting out there with no protection. That's going to take all the way until the spring to get that targeted Omicron vaccine. So get protected in the winter. And then when you roll around to the spring, we get to question number 3. Okay, if I get this third booster shot, how safe am I? Well, the answer is you're very safe. With 3 shots, you'll have around a 95% chance of avoiding serious illness. You might still get infected. There are many breakthrough cases. It might be 20% of them against Delta. But the illness shouldn't be much worse than a bad cold. But hear this, and I think this is where you were headed, Jill. This is only for the time being. Pfizer's top scientist thinks that people should plan on getting the targeted Omicron vaccine in addition when it's ready later this spring. So yes, that would be a fourth shot for maximum protection. Now, that takes us to question number 4. I know it's something on your mind, Jill. This is a mutating virus. By the time I get the targeted Omicron vaccine, there'll probably be yet another new strain. And so what's the point of getting vaccinated over and over and over and over again? But here's today's headline. Get vaccinated or get COVID. It's one or the other, scientists say. If you remain unvaccinated or only partially vaccinated, you will surely catch this coronavirus sooner or later. And without protection, you may well be facing serious long-term illness, not to mention the chance of joining the 800,000 Americans killed by the coronavirus so far. Now, I trust you've seen the COVID cases surging this winter, this indoor season that we're in. They're surging like crazy. We're back to over 100,000 cases each day in the country, climbing toward 2,000 deaths each day. In Connecticut, just for instance, the positivity rate has topped a frightening 8%, and hospitalizations have hit 576, and that's up 180% in a month. And roughly 9 out of 10 of the very sick and dying, 9 out of 10 all over the country, are among the 65 million people who flat out refuse to get vaccinated. So okay, Jill, any questions or comments so far? Is this getting across?
It's getting across. It doesn't reflect a practical reality, but it's definitely getting across.
Practical reality in what sense?
I personally know numerous people who have chosen not to get vaccinated. They are not sick. Most of the people I know who are sick and who are in hospital have breakthrough cases as well as comorbidities. It's flu season, so this is typically when people and I will also add at this point of the 10 people I know who have gotten like really sick, miss work sick in the last 2 months, not one of them has had COVID.
Oh, they just got sick. Yeah, people get sick.
No, but they like sick, miss work sick. So not fun. They're staying home with real bad stomachs and sniffles and whatnot. So
okay, let's cut to the chase here. 9 out of 10 of these cases of now we're talking coronavirus, all right? 9 out of 10 are people who are unvaccinated. That should tell you that if you're not vaccinated, you're asking for it. So. All right, question number 5. There are reports out of South Africa that Omicron might be infecting more children than the original virus or Delta. And what do the scientists know about that? The answer is not enough yet. I mean, South Africa has a high proportion of young people. That may explain the numbers. Meanwhile, on the positive side, the cases among the young and others have been mild, mostly mild, and that's with Omicron as well. So as I reported last week, scientists have a theory. Now, Omicron is extremely contagious, very transmissible. Okay. But scientists think that the more contagious the virus, the less severe its sting. It's as if the virus uses most of its potency spreading disease and has less energy to get you very, very sick. So that's a theory about Omicron, but it may indeed be true. We'll see.
And then what does that do if it's highly transmissible and everybody gets it? Isn't there a point at which you can say, hey, you got herd immunity?
Yeah, but herd immunity, yes, but we're nowhere near there, Jill, because we're not at something like 85 and 90% of the country being vaccinated. It's only about 2/3. You got many, many unvaccinated people who can be hosts for this disease and have it and help it mutate, which actually leads us to this next question, question 6. Where does this thing come from? Well, the leading theory is that it evolved in an immunocompromised patient over many months, thereby allowing the variant to see all sorts of antibody treatments and to adapt to it and evade it. That's the leading theory about where it came from and where the next one's going to come from, which leads us to question number 7. Will lawmakers have to resort to drastic action led by massive vaccine mandates to get through the pandemic? Now, sadly, I believe lawmakers must do that. Nothing else from reasoning with people, bribing them with lottery tickets and concert tickets and money and whatever. None of that has convinced the hardcore 65 million holdouts to get jabbed. But the vaccine mandate, anything like that, is going to be an awfully rocky road. President Biden's effort to require all employees of big companies to get vaccinated or tested to go to work, that's very unpopular. It's been slapped down in the courts up to now. In addition, Republican senators just this week and a few Democrats, including Dino, that's Democrat in name only, Joe Manchin, just voted 52 to 48 to scrap the Biden mandates. So, and by the way, if that bill ever got to Biden's desk, he would kill it by vetoing it. But still, the sentiment is out there. It's very anti-vaccine mandate. But I love the grandstand move by de Blasio, the New York's outgoing mayor, Bill de Blasio. This week just ordered all workers in the city to get vaccinated. And he's going to leave, and he's going to be out of office very soon. And I fully expect the new mayor to shelve that order, but he's going to be shelving it just for the time being. Okay, so Jill, what do you think? Obviously, you're not in favor of these mass mandates for vaccines, but do you think we're going to see more of them as this pandemic continues to threaten us? We're going to see more, or are they going to fade away?
They're going to fade away simply because you can't get them through the court.
That may happen.
Well, I mean, every single one that's been attempted, and the federal contractors one went down a few days ago. Every single one that's been attempted, what I'm trying to say is the most recent one was every state. So, you've got a court system, and so. Right. That's all I'm saying. You got to get it through the court system.
Yeah, and the courts have not been kind to these mass mandates, which is unfortunate because I don't know another way to get the hardcore people to get vaccinated and keep everyone safe, including themselves and their family.
Well,
let's turn to a personal. We got to turn to a personal level here. So this is question number 8. Hey. Do we yet again have to upend our family holidays gatherings? So you got to do this again. Look, I say not necessarily, but you got to be careful. So it's going to be awkward with friends and family especially, but you should ask everyone you plan to spend some time with their vaccination status. Now, Carolyn and I, this is personal, will not visit with anyone who isn't double vaxxed. We don't let anybody come into the house, deliver food to us who aren't double vaxxed. Now, there is one exception. That's our 3-year-old, gorgeous, redheaded, blue-eyed Gigi. She's so cute. But at Thanksgiving, her mother got her tested ahead of time so that we could feel safe. And by the way, there is a hope that we'll have a vaccine for children as young as 6 months by this summer. And as you know, right now, kids need to be at least 5 years old to begin getting their shots. But by the summer, we may have vaccines for someone like little Gigi.
So quick question, though. Just yeah. And that is, what are we going to do when the people who are currently fully vaccinated lose their full vaccination status, which is imminent?
When the people who are fully vaccinated lose it? Well,
yes, because
that's what I'm talking about.
That's
Jill,
what I
that's
mean.
what I'm talking about. You've got to get jabbed again.
Right,
so,
and then again.
I mean, we're talking about 3 jabs, but the scientists at Pfizer is saying you're going to need 4 jabs. You may need 6 jabs. Look, every flu season we get another shot. I mean, this may work out until we get a handle on it. This may mean every 6 months we get a jab for the coronavirus. That may be exactly what's happening because the antibodies wane. They wane 3 months after COVID. They wane 6 months after a shot. So, yeah, we may need shot after shot after shot. But if that's what it takes, I'm happy to go down there and get jabbed. And when the vaccine is available for little Gigi, I know her mother is going to take her there. And, we've got another grandson who is over 16, and he's going in for his 3rd shot because he's now eligible. 6 months after he had his second shot. Look, here's where we're headed on this. Biden has done one smart thing here by ordering all the health insurance companies to cover at-home test kits, which can give you a lot of peace of mind, right, about whether I can go out. Well, am I safe? I ran into somebody. Am I still safe? All the insurance companies, all the private insurers have to make that available to you free of charge. You get reimbursed, okay? But that covers the people with Medicare Advantage because that's underwritten by private insurers. However, at this moment, it seems like there's a loophole. It does not cover people on original Medicare because that's underwritten by the federal government. You can. I'm counting on it, Jill. You're going to hear more from this as AARP and others just howl about it. The UK, other countries are giving these kits away free to everyone. And we should too. I mean, for $20, for $20 to $30 for a home test kit, you can get a lot of peace of mind, especially going into the holiday gathering season that we're in. I'd only add this: if you can find these tests, I mean, they disappear from drugstore shelves immediately. So here's my strategy. I go into the drugstore. I find out when the next shipment is coming in because the shelves are always empty. When the next shipment is coming in, okay, Monday morning, I'm down there as early as I can and I grab a handful. Also, it's really tricky again about travel. Even with mass mandates, requirements in terminals and planes and trains and so on, there's still a breeding ground for COVID, unfortunately. A double vaxxed friend of mine just flew down to Florida. She couldn't avoid it. She had to see her sick father, and son of a gun, she got COVID. She's sure she got it at the airport. It's very common, so you got to really think twice about travel. But I say if you're triple vaxxed and you're careful and you wear your mask, you should be fine.
So the healthcare detective and health correspondent for Parade. Send your questions or concerns about finding affordable healthcare to Healthcare Detective at Robin Hood Radio. Frank will try to address as many of your questions as he can on future broadcasts. Also, look for his book, Your Best Healthcare Now, available online, in store, and on my desk.